How is everybody doing? I hope you're doing fine. This is JEMIENAFTALY and the channel's name is called The Pediatric World. So I welcome you to my YouTube channel, and it's only here, it's only in this platform where we talk, we discuss with the mothers, with the caregivers, with everybody on the common illnesses that affect our children while growing up. And here we try to be as layman as possible. We want to use a simple language so that everybody is able to understand. The end result, we want to have healthy babies and to improve their quality of life. So I welcome you back. If you're new, welcome to this channel. So today's topic is on the neonatal sepsis. And what is neonatal sepsis? So, and who is a neonate? A neonate is any baby who is 0 to 28 days old. So then this is a 1-month-old baby. What are sepsis? Sepsis are infections, and we are saying that these infections commonly affect these 1-month-old babies. So then neonatal sepsis are the presence of serious bacterial infections. And we have examples of like meningitis, things like meningitis. We have pneumonias. We have pyelonephritis. Pyelonephritis are diseases of the kidneys. They also have diarrhea and vomiting. So these are examples of the infections we are talking about. So we are saying they are serious bacterial infections. And again, they can also be fungal and viral. So basically, that is what neonatal sepsis is all about. So what is the classification of the neonatal sepsis? We have 3 major classifications of the neonatal sepsis. Number 1, we have congenital infections. Congenital meaning inside the womb, the baby is not yet born. So these infections get to the baby even before they come out. We have a second classification. We have the early onset neonatal sepsis. So these are infections that present within 24 to 72 hours of life. The third classification is the late neonatal sepsis, and these are infections that present from 4 days to 90 days of life. So basically, those are the 3 classifications of the neonatal sepsis. What are the risk factors? And we are going to see the risk factors in each classification. So risk factors in early neonatal sepsis. We have things like maternal colonization by the microorganisms. And we are saying these infections can be transplacental. They pass through the placenta and reach the baby. So, and the mothers have produce a very bad smelling amniotic fluid. Amniotic fluid is this fluid that comes before the baby is born. So it is usually it has a bad smell, and we call this foul smelling amniotic fluid. The mothers present with fevers, they get high temperatures. So when we see this, we get ready to treat this neonate for the neonatal sepsis. So these are risk factors. At delivery, the microorganism may bypass the birth canal, so reaching the babies again. We have things like PROM. PROM are premature rupture of membrane. So if the water breaks before the onset of labor, these babies are going to be at risk of getting these infections. Again, if the water broke before the 37 weeks gestation. So again, this is a cause of a risk factor to neonatal sepsis. If we have prolonged rupture of membrane, this is when now the labor goes beyond 18 hours, and these babies are going again to have this neonatal sepsis. Other things are maternal UTI. If the mom had a urinary tract infection during their last trimester, these babies are going to be again at risk of getting these infections. Prematurity is another risk factor to getting neonatal sepsis. Remember, in our last episode, we talked about the premature babies. So if the baby is premature, they are going to have these infections again. So what are the risk factors? Before I go to risk factors in late neonatal sepsis, let me say that these microorganisms you are talking about, they are both gram-negative and gram-positive. Yeah, so they are gram negative and gram positive. So what are the risk factors in the late neonatal sepsis? So these ones are usually acquired, and when I say acquired, now the baby has come, we are saying late neonatal sepsis is from 4 days to 90 days, and these are introduced by mostly the professional caregivers. When you're taking care of these babies, the baby is here, so hand washing is key here. The professional caregivers are advised to observe hand washing, good hygiene, because they introduce these infections while putting those urinary catheters. For example, when they are putting the line through the vein, they are looking for the vein to put so that the baby can be put on maybe fluids or even the IV drugs. So we keep pricking, and the high risk of we introduce these infections to their skin, and the baby ends up getting the neonatal sepsis. So we are saying a good hygiene here is key. Other things in late neonatal sepsis are prematurity again. So we are saying prematurity is a risk factor in both early onset and late onset. We have, so those are the risk factors in late neonatal sepsis. The other one was congenital infections. We say these are infections inside the womb before the baby comes, and they are infections like HIV and others. So what are the classifications of what are the clinical presentations of these neonatal sepsis? How do these babies present when they get these infections? So number one, they present with refusal to breastfeed. The baby is just there crying, very, very irritable, so they refuse to breastfeed. These are one sign. They present with temperature instability. They can have hypothermia. The temperatures can be low or high, so they can have hypothermia or hyperthermia. They can have fevers. So other presentations, we are irregular breathing. Remember, we said they have apneic attacks. They pause, they breathe, then pause. So they have irregular breathing. They also present with cyanosis. Cyanosis is the blue discoloration of the skin. So normally a normal baby should be pink. So if they start presenting with the blue discoloration somewhere, this is what we are calling a cyanosis. And this is due to there's not enough oxygen. There's not enough oxygen and blood supply to their body. So they present with this cyanosis. They have tachycardia. Tachycardia is when the respiratory rate are so high. They breathe so fast. So this is what we are calling tachycardia. They also have cold extremities. We are saying we should ensure that they are warm, but when you find that the extremities are from these parts going this way and also the legs, they are very, very cold. So these are presentation of neonatal sepsis. These babies have a reduced urine output. They are not able to pass urine the way it should be. They also present with convulsions. Convulsions are tremors. The babies convulse. So this is a presentation when they have this neonatal sepsis. They also have bulging anterior fontanelle. Fontanelle is this part. This is this part that normally pulsates. So we have anterior fontanelle and posterior behind here. So this anterior fontanelle, normally it should be flat. It should be flat. But when they have neonatal sepsis, it is usually bulging. It is bulging. So this is what we are saying. They are going to present with bulging fontanelle. They have neck stiffness. So when you want to fold their neck, it is very painful. The babies cry. And also there is a resistance. It's not as soft the way it should be. So neck stiffness. They also present with jaundice. Jaundice is the yellow discoloration of the eyes and the bodies. We talked about it. So they are going to have this jaundice. They also have hypoglycemia. Hypoglycemia, we say, is a killer. And this is when the blood sugar levels are so low. So we should ensure that these babies, their sugars levels are the way they are supposed to be. So, and this we say it is by ensuring that they are breastfed, we breastfeed them the way they're supposed to be breastfed. So now you know what neonatal sepsis. They are very serious infections and they affect these small babies. We are saying 1 month old babies. So we now know what it is all about. We know the classification. We know the risk factors. So you see why I insist on antenatal clinic, because it's during this time that you're able to see that the mother has UTI, for example, and we treat it completely so that it does not eventually affect our baby, the neonate. So this is it for today. In our next episode, now we are going to see how to manage, how to treat this neonatal sepsis. So stay tuned and don't miss this. Thank you so much for staying with me. Keep subscribing. Subscribe if you haven't. Like, share these videos widely so that many people can get them. And also leave a comment on the comment section. And also hit on that notification bell so that you are able to know whenever I post a new video. Thank you so much. Till next time. Bye-bye.